Endometriosis are abnormal tissues found outside the womb. Like this model, the endometrium lining is usually situated in the inner cavity. But once these tissues are found outside, like in the ovary, tube, or even within the wall itself, then it's an abnormal situation. So if we have a sample in the lab, tissues look exactly the same as cells or the tissues lining the interior wall of the uterus or the endometrium. So the most common place where endometriosis can develop are in the ovaries. It gets collected like a cyst, a big cyst, and we call that endometrioma. It can even affect outside, like on the tubes here, and it can frequently cause an inflammatory process. So it's common to see adhesions like this. So when it's advanced, this whole structure looks abnormal and stuck to the uterus and even stuck to the other ovary as well. The cause is unknown, but we know it's dependent on hormones like estrogen. If you're older, your menopause is unlikely to cause real trouble, endometriosis. But if you're in a younger age group, still reproductive age group, then it's quite a common situation to see.
Endometriosis is an enigma. It can sometimes cause minimal symptoms, no symptoms, but sometimes it can also cause severe symptoms. The most common symptom would be painful period. The painful periods caused by endometriosis is different from the normal menstrual cramp in terms of severity and in terms of duration. The pain can actually start a few days even before your menstrual flow starts, and it can persist until the end of your period flow. Besides pain, it can also sometimes cause irregular and heavy period. It can also cause pain during intercourse. The symptoms caused by endometriosis usually depends on the location of the endometriotic spots. So if it's at the pouch of Douglas, it can really cause pain during intercourse, and it can cause pain during bowel movement. We have also seen commonly patients who doesn't have any symptoms at all, but the endometriotic spots are usually only discovered during surgery. So these are the patients who usually present with infertility, but when they're investigated for infertility, they found out to have endometriosis.
Endometriosis is actually quite common in women having period. 10% of the general population will have it, and if you are having fertility or problem with conceiving, there's 30% chance of the women will have this condition. And if you have a constant period pain over a long period of time, there's 60% chances that you might be suffering from this endometriosis. If your mother or your sister is having endometriosis, there's also very high chances that you might have this similar problem. So endometriosis is actually very common among the women.
In the use of medications for treatment, we can use non-hormonal medications, and this would depend very much on the severity of the symptoms, and the symptoms are almost always just pain and how bad the pain is. To have some simple medications like paracetamol taken about 3 to 4 times a day for first or second day would solve the pain that she has for some of the minor ones. But some do have more severe pain, and that's when you need to go into stronger forms of analgesia. This would involve the usage of non-steroidal anti-inflammatory drugs, whereby they act on the prostaglandins to reduce some of the inflammation, and that works more effectively. And they're also to be taken on a lesser dose, so 1 tablet twice a day will be sufficient to cover her instead of taking 4 times a day as opposed to paracetamol. Some women, of course, may have other symptoms like associated bleeding issues or heavy periods. That's where we add on other medications like tranexamic acid to be taken during the duration of the period.
For treatment, our modality of treatment is actually to modify the hormones. It's quite common that we'll provide you with a hormonal medication to control endometriosis. We need to reduce estrogen as produced by the body. And birth control pill like this, and many brands around, take it long term, your body will not produce estrogen as before. It will be controlled by what is designed in these pills. So over time, your overall production of estrogen will be much less. So you can get a reduction in symptoms of the endometriosis. There's also a new brand of hormone called Visan, which is just progesterone, can kill off the early deposits of endometriosis and has been proven, and we use it quite widely. So if the pills does not work, or you need to use better form of hormone control without ingesting, then we have what looks like an IUCD or intrauterine contraceptive device, but the brand is called Mirena. It's not just empty plastic. The brand has a medication called progesterone inside the IUD. It's placed like a contraceptive device, placed into the uterus, and it can sit there for more than 5 years. So this will allow the reduction of the growth of new endometriosis, and if the endometriosis has caused painful and heavy blood loss, this can also treat that symptoms.
One of the treatment for endometriosis is using GnRH analog. Besides oral medication and surgery, GnRH analogs, one of the possible alternative treatment for endometriosis, is given in the form of injection. It's actually part of the hormonal modulation, and it acts by stopping the ovaries from producing estrogens, because the endometriotic spots is related to the menstrual cycle and is dependent on the estrogen. So when you stop the ovaries from producing estrogen, you are actually causing a regression of the endometriotic deposits. So when this happens, patient will not have any more bleeding, no more inflammation at the surrounding area, and eventually this will cause a resolution in their symptoms such as pain. However, GnRH analogs cannot be given more than 6 months because it causes the patient to be in the pseudo-menopause state. It tips them into menopause. They will have no periods, they can have hot flashes, and they can prolong treatment with these GnRH analogs can also cause osteoporosis. So this treatment is not suitable to be given long-term, more than 6 months. GnRH analogs can also sometimes be given after surgery to reduce the risk of the endometriosis coming back, to reduce the risk of recurrence of the endometriosis.
When it comes to surgery in endometriosis, if you are young and you still have planned to conceive further, generally the doctor will just do a surgery to remove the endometriosis that they can see. This can be a repeating process as long as you have your womb and your ovaries in it. If you are on the older side, or if you already suffered too much from the pain that is brought by this endometriosis, probably you can be recommended to remove everything, which may include your womb, both your ovaries. This means that you'll go into a menopausal state, and this is a surgery that do come with its own risks and complications. Your doctor usually will recommend this as a last resort as a treatment for endometriosis.
Living with endometriosis can be one of the most challenging for a lady who unfortunately is inflicted with endometriosis. The pain that she has to bear can be so bad that it disrupts daily lifestyle. It can affect her concentration, her work performance in schools. It affects their relationship with their family, affects their marital relationships. This sort of long-lasting chronic pain, well, it's not just physically debilitating, it's also psychologically very challenging for a lady to go through with this. So besides medical treatment, surgical treatment, they often need support groups, help them manage this unfortunate condition. So it's best to seek advice or medical consultation very early if you have any of these symptoms or suspicion that you may have endometriosis.